Welcome to another important forensic toxicology topic, heavy metal poisoning. What are the learning outcomes? To understand heavy metals and common examples of them, to recognize that heavy metal poisoning can be easily overlooked due to non-specific symptoms, to suspect heavy metal poisoning in specific occupations and homicide cases with peculiar features, to identify the common and suggestive features, to know how to collect samples in a suspected case, and to know about important medico-legal aspects. Let's think about a definition. Heavy metals are dense, naturally occurring elements with atomic weights generally greater than that of water. They are toxic to living organisms even in trace amounts, as they can accumulate in tissues and disrupt essential biological processes. Essential versus non-essential metals. As you can understand, we need some metals in trace amounts. Examples: iron, zinc, copper. But in high doses only, they are going to get toxic. However, there are certain other metals where even with small amounts could be very toxic, such as arsenic, lead, mercury, cadmium. What do you mean by heavy metal toxicity then? It occurs when metals accumulate in soft tissues, causing cellular damage and disrupting biological functions. The severity definitely depends on various types such as exposure level, duration, and also depending on the type of metal, etc. etc. What are the commonest type of heavy metals that could cause lots of problems to human and other environmental animals? Arsenic, lead, mercury, cadmium, and chromium. Though I defined the term heavy metal as earlier, there is no consensus on the definition of a heavy metal. As a result, you can read this slide leisurely. Regarding the sources of heavy metals, contaminated food such as fish or rice, water sources, drinking from older water systems such as with lead pipes, and also with industrial dumping of waste matter can get lots of heavy metals, occupational exposure, medications and other supplements, especially Ayurvedic and other traditional herbal products, handling of metal products without personal and protective equipment, and also with power plants where they are going to burn fossil fuels with biomedical waste, as we have described with industrial activities, mining industry, electroplating as an e-waste during agricultural activities, and also with volcanic eruptions. So we can see heavy metals everywhere in earth, air, and water. Everywhere we can see heavy metals. Learning about high risk groups: children, higher absorption rates, hand to mouth behavior, developing bodies, obvious. Pregnant women and developing fetuses, certain heavy metals can pass through placenta, causing accumulation of those in the newborn. Workers in high risk occupations, as you can understand, low income and industrial area residents. So they tend to expose heavily because of the close proximity to the industrial sites and waste areas. Indigenous and rural community, they are going to use their own herbal products, and also they are going to participate in mining and other industrial operations near living areas. Older adults, actually, they have got cumulative exposure over the years, and also they have got weaker detoxification. People consuming contaminated food and water, seafood consumers could get risk from mercury in fish such as tuna and shark, and also with traditional medicine. We can't pass by without mentioning about food chains. Heavy metals can be seen in everywhere, including earth crust, water, and air. So easily, such heavy metals can enter into plants, and bodies of animals, causing lots of human health problems and also environmental harm as well. From here onwards, we are going to discuss one by one about heavy metals. First of all, arsenic poisoning. We can see arsenic all over in the Earth's crust, and also we can notice seepage of such arsenic into groundwater. During industrial processes, also release arsenic. Tobacco plant can absorb such arsenic within the soil. So you can understand in smokers, there could be arsenic poisoning. During cosmetic production, yes, they are going to use certain heavy metals. And also because pesticides have got lots of arsenic, there may be lots of poisoning even with rice. How about the routes of entry into the body in general actually? Here this is general. Now it could be due to ingestion, such as in contaminated food and water. During inhalation, that means breathing in tiny metal particles. As we have described, we can see everywhere in air, so easily can get inhaled. Skin absorption, contact with metals or metal containing products. However, moving on to the arsenic again, arsenic is colorless, odorless and tasteless heavy metal, making it difficult to detect if somebody is going to mix even to a food. And also it has been used for centuries as a means of poisoning, especially in cases of slow poisoning. So now you have to understand about that fact in case of arsenic poisoning. Any heavy metal poisoning could be acute or chronic. So in case of acute arsenic poisoning, it occurs over a brief period of time and also with a larger concentration at times. So it could cause mainly GIT symptoms such as abdominal pain, encephalopathy and watery diarrhea that contains blood. Moving on to the chronic poisoning, there may be lots of skin changes that I am going to describe during the next slide. Hyperpigmentation, hypopigmentation and thickening, peripheral neuropathy, numbness and tingling in extremities, Mees lines, as you can see here, increased risk of cancers including skin, lung, liver, bladder and prostate. Arsenic can affect in all organs. However, it is mentioned that skin is one of the major organs. So here we can see hyperkeratosis, formation of warts or lesions, as you can see here. Thickening of palms and soles. And also, as the next important finding, we can see dark brown patches with scattered pale spots over the skin. Sometimes we are going to describe it as describing again about Mees lines. As you can see here, so those are white horizontal bands that can be seen more than one nail simultaneously. So those are parallel to lunula, as you can see here. Most commonly it is seen in arsenic poisoning. However, moving on to the second heavy metal, that is lead poisoning or plumbism. As you can see here, what are the sources of lead? Now this is a very nice slide because we can easily remember the sources. In early days, for house paintings and other things, they have used lead as a base. So easily the environment can be mixed with lead, as you can see here, as dirt and also lead dust. And also in some paintings of pottery work, and also there may be certain industrial activities or hobbies related to lead metal, and also in traditional remedies such as makeup and powders, in certain food items as coloring, some jewelry and some toys. Here you can see a very nice image here. In early days, they have used lead pipes to transport water from one place to another because it's easily fixable. So as lead can cause damage to a developing child's brain and also nervous system and may cause permanent learning and behavioral problems. And also during acute poisoning, there may be intestinal colic, and also with chronic poisoning, there may be purple bluish line on the gums, which is termed lead line or Burton line, and paralysis of the radial or peroneal nerve causing wrist drop or foot drop, and symptoms of anemia, nephropathy, and encephalopathy with cognitive impairment. As you can see here, now with the chronic exposure to lead, you can see lots of changes that I have described partly earlier. Here now, as you can see in growing bones, you can see metaphysis here, the accumulation of lead here as lead lines. And also you can see Burtonian lines or Burton lines on the gums as well. And also you can see wrist drop here. So now these are chronic features of lead poisoning. And also you can see basophilic stippling of red blood cells due to lead poisoning. Now you can see a lot of normal red blood cells here. Now these are normal red blood cells, whereas to that you can see lots of basophilic stippling here and there. So this is because of the clustering of ribosomes due to the accumulation of or the effect of lead poisoning. So this is not the only cause where you get basophilic stippling. However, even third one is mercury poisoning. I am not going to describe much. You can read leisurely. Sources of exposure: industrial emissions, contaminated water and fish. So now this contaminated fish and water is a very important thing in relation to mercury poisoning, and also with dental fillings, and also certain products such as thermometers, batteries and fluorescent bulbs, and some. And also there may be acute and chronic poisoning, as you can understand here. So we are going to describe more during the next slide. So there may be natural sources such as volcanoes and weathering of rocks, and also due to anthropogenic sources such as industrial discharges that I have explained earlier, and also routes of entry: inhalation, ingestion and dermal absorption, and also through maternal to fetus. Now these are the symptoms. In case of acute one, there may be gastrointestinal irritation, vomiting, diarrhea, respiratory distress, neurological symptoms, tremors and seizures. With chronic mercury poisoning, there are two things that we are going to discuss in detail. There may be a disease called pink disease or acrodynia. That means there may be pink hands, feet due to irritability. And also there may be lots of neurological deficits such as memory loss, ataxia, and also Minamata disease because of the eating of lots of fish at Minamata Bay. There had been lots of cases of mercury poisoning, as you can see here, right? So now ataxia, impairment of speech and hearing. So now this is a case of pink disease. Fourth one is the thallium poisoning. Due to that, there may be lots of symptoms such as neurological symptoms, as you can see here. And also one thing that I am going to describe in detail: alopecia. That means hair loss, often occurring within days to weeks. You can see it in axillae or eyebrows, all right. And also you can see it. So as you can see here, now you can see here loss of hair. And also, as I have described earlier, Mees lines you can see here as well. Moving on to the fifth heavy metal poisoning, that is cadmium poisoning. Again, lots of sources. Here, in case of acute exposure, there may be breathing difficulties, damaging lungs, leading to death. In chronic exposure, there may be kidney damage, bones, and also it is a known cause for malignancies as well. For cadmium poisoning, one thing that you have to remember: cigarette smoke. Usually it is believed that tobacco plant is going to absorb lots of heavy metals, especially cadmium, from the soil, causing a danger to smokers. Next one is chromium poisoning. Here again, lots of details that I am not going to discuss much. However, through inhalation of chromium heavy metal, there may be nasal septal perforation. It is because of the corrosive effect. The next one is silver poison. It is not that toxic when compared to other heavy metals. However, now here is one of the photographs that we can see. A 92-year-old man with argyria. What do you mean by argyria? You can compare of the skin color of these two people. That means this person was using for a long time of a nasal drop with silver metal. So now it's time to discuss about medico-legal importance and heavy metal poisoning. The first thing is high suspicion because it has got common symptoms for other diseases and mimic many other diseases. And also suspicion is very essential for legal action and to get compensation such as in occupational diseases. How about sample collection? Now, blood is one of the best samples as always because it could give the real-time values as well. And also urine, probably 24-hour collection. We can get the idea about the exposure, recent exposure and excretion and the levels, etc. etc. Now, there are three other samples that you essentially have to talk about in case of heavy metal poisoning. What are they? They are hair, nails and feces. Now, hair and nails should be examined in any suspected case of heavy metal poisoning or in chronic exposure. And also feces. It is very helpful in acute poisoning and also in chronic poisoning as well. Tissues, example liver and kidney, you can test for heavy metals by taking certain samples. As I have described earlier, there may be lots of mimicking disease entities such as GI symptoms, neurological symptoms and renal disorders and malignancies, etc. One of the most important medico-legal aspects is homicidal poisoning. Arsenic, mercury, lead and thallium are famous for that. The next one is compensation and legal aspects. Proper documentation and adherence to legal rules ensure justice and rightful compensation for victims. And also, it is needed to notify about such cases as well. What about post-mortem samples for testing in suspected heavy metal poisoning? We have described everything. However, again, I want to highlight certain factors, right? So, feces and hair and nails and also saliva. At times, it is important to check. And also, there should be other medico-legal important aspects such as investigation of environmental and occupational exposures and forensic analysis, not in homicidal cases but also in accidental and iatrogenic and suicidal cases as well. And also there should be strict regulations for safer levels in food, air and environment. Example, lead could be emitted from vehicle exhaust pipes. So in such cases there should be. So now it's time to practice certain MCQs. Which of the following is true or false regarding heavy metal poisoning? Suspicion of heavy metal poisoning is crucial as it shares symptoms with other diseases. What do you want to tell? Yes, it's correct. We have described it. Some heavy metals cross the placenta causing fetal abnormalities. So it's a fact. You should know about it. Heavy metals are present in the air. Yes, lead, as I have described earlier, with emission from vehicles and also with volcanoes eruption. Everywhere we can see lots of heavy metals. Nails are essential for testing in chronic heavy metal poisoning. Definitely true. Feces are essential for testing in heavy metal poisoning. Yes. I have described about three different samples. That means nails, hair and feces in case of heavy metal poisoning. Arsenic and thallium had been used in homicidal poisoning because of their tasteless, colorless and odorless qualities. Yes, so it's a fact. Arsenic and thallium actually, blood is not indicated for testing in heavy metal poisoning. It's completely incorrect. Alright, so blood is one of the best samples. Saliva is tested for heavy metal analysis in the body. Yes, it's true. It's true. Occupational risk should be evaluated in certain high-risk jobs for heavy metal poisoning. So again, it's a must. Time to time, ideally, such people should be tested for heavy metal poisoning. Excessive fish consumption is a source for mercury poisoning. Yes, definitely. Minamata disease is due to thallium poisoning. It's incorrect. It is due to mercury poisoning. Heavy metal poisoning may be associated with malignancies. Yes, it's a known fact. Since arsenic is colorless and odorless, it is used for homicidal poisoning. Definitely correct. Hyperkeratosis is markedly seen in thallium poisoning. No, it's incorrect. It is seen in arsenic poisoning. So this is incorrect. Hyperkeratosis is markedly seen in not thallium poisoning, but in arsenic poisoning. Raindrop appearance on a dusty road is a neurological sign. No, it's a dermatological sign where you can see hypo and hyperpigmented areas. So this is incorrect. Raindrop appearance on a dusty road is noticed in lead poisoning. It is again incorrect. It is seen in arsenic poisoning. Again, true or false questions. Argyria, a bluish-grey permanent discoloration of the skin and mucous membranes, is noticed in lead poisoning. It is incorrect. It is seen in mercury poisoning. Arsenic is the only heavy metal known to cause mesalines. Again, incorrect. You can see it with thallium poisoning as well. Dehydration is a known mechanism of death in acute lead poisoning. It is incorrect. It is seen in acute arsenic poisoning. As you can understand, it causes diarrhea that could cause dehydration leading into death. Smoking can cause cadmium poisoning. Yes, it's true. As I have described earlier, the tobacco plant can absorb cadmium from the soil, causing heavy metal poisoning while smoking. Nasal septal perforation is associated with thallium poisoning. No, it is with chromium poisoning. So it is incorrect. Alophasia is a known feature of thallium poisoning. Yes, it is correct. Basophilic stippling is seen in arsenic poisoning. It is incorrect. It is seen in lead poisoning. Analysis of hair is needed to diagnose chronic heavy metal poisoning. Yes, I have emphasized enough. Nail hair should be analyzed in any suspicion of heavy metal poisoning. Chronic exposure to heavy metals is revealed by a urine sample. Yes, it's still true. Not only in acute poisoning, still there are certain accumulated heavy metals that can be excreted through urine. Burton's line is seen in the bones. No, it is seen on the gums in lead poisoning.